Good morning, everybody. This is Matt Melton, Planning Section Chief for the EOC. This is the Anchorage Emergency Operations Center update. All right, folks. I don't know if everybody got a chance to see it, but PIO did a great job filming Mautosi getting his second vaccine dose and taking his mother in to get hers as well. Pretty cool video. If you haven't seen it, it is on our YouTube channel, our Vimeo channel. It's on Facebook. I think the health department and OEM both ran it. Great job by our public information team. And it's one person that everybody kind of looks to for as a leader in our communities. And so please take a look, share with your friends as you can. Luke, can we have an update, please?
Good morning. This is Luke Orr, Situation Unit Leader. Today's 411 of our response. Statewide, up 369 cases, 19 deaths, and 16 hospitalizations. And locally, up 131 cases, 8 deaths, and 4 hospitalizations. Next slide. For 213 resource requests, we filled or otherwise satisfied 1,732, and an additional 2 since the last report, with 20 currently open and working. Next slide. We had 74 non-critical transports in the last 72 hours, with none after hours in the last 24. In the congregate sheltering sites, we have 428 clients, up 12. In the non-congregate sites, 303 clients, down 8. That's a total of 731 clients in all shelters, up 4, averaging 2,193 meals served per day. Over the weekend, at the Visit Healthcare testing sites, there were 1,142 sample collections performed, averaging 52 per hour. And in the last 7 days, 5,140 sample collections performed. For our vaccine numbers, only at the Visit Healthcare sites, since the last report, at Dempsey, 616 doses. At the Blood Bank, 23 doses. Shiloh Baptist Church, 216 doses. Diamond Center, 360 doses. North High Mall, 42 doses, and none at Visit Lowell. End report.
Wonderful news you have for us today.
Yep, good morning, everyone. This is Adam from the National Weather Service. Going to be a really nice week, mostly sunny with temperatures in the 50s. That's end of report.
Thank you, weather. Operations.
Hey, good morning. In our mass care branch, Q&I has 8 projected discharges through Wednesday and discharges 1 today. Our warming tent had 50 people over the past 24 hours. And, this is Joe Calavig, Operations Section Chief. In our public health branch, visit testing had a decrease of 3% over the previous week's collections. The 7-day rolling positivity rate average is 2.65%, a decrease from April 15th. The 14-day average reproductivity rate is 0.986, and the 14-day average case rate is 22.27 per 100,000 population. For pop-up testing, today through Wednesday at 800 K Street, 8 a.m. to 7 p.m., and next Saturday, April 24th at Mountain View Elementary from 8 a.m. to 7 p.m. In our medical countermeasure branch for Visit Healthcare, the Northway Mall drive-through site got up and going this weekend and ran smoothly. They are accepting appointmentless individuals. We're working contract amendment to include new line items for pop-up clinics. We're planning on increasing no appointment required signage to get that visibility out there for folks. And we're requesting additional daily data reporting, including timestamp no-shows and walk-ins. For Fairweather, pop-up clinics this week through the Conquer COVID Coalition, GCI Alaska Club, Cook Inlet Travel Council, and the Carlisle Manor. We're beginning weekly coordination meetings due to an increasing need for pop-up clinics. Vaccine week planning for Alaska Airlines Center and pop-ups during both weekends and weekdays. For our EOC mobile task force, we continue outreach to homebound organizations to promote the call line request. We're planning small drive-through clinics for vaccine week, which will require moving to a different location each day. We're going to use an RV and existing equipment and crew for that. We'll also offer later night options than have been offered before for workers who get off late. End of report.
Thanks, Joe. We had a question in the chat. Any idea why so few vaccines delivered at the blood bank? Is that something you could answer now, or maybe get back to Alex on that?
I can get back to you on that.
Roger. Thank you. Logistics.
Morning, it's Scott Carpenter, the Logistics Section Chief in the EOC. This morning's report for medical countermeasures. You've heard the term pop-up sites, so of course we're working to support that as well. We're also working to get the mobile team schedule all hashed out and ready to go for May. Under mass care support, we continue to work on the summer support requirements, contract modifications as necessary, and we've added some training contracts as well. In the EOC, we'll continue to support the additional staffing request, work on the transition planning, event planning as necessary, includes logistics.
Thank you, Scott. Finance.
Good morning. This is Carrie Wiedeker, the EOC's Finance Section Chief. Currently, the EOC has encumbered $19,610,354. Our actual spent to date is $46,451,770 for a total of $66,062,124. Please continue submitting any invoices you have and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery in the form of FEMA public assistance. For information related to that, please contact Erin Zachary. End of report.
Good morning. This is Annalisa Roberts reporting out for safety. So in keeping with Distracted Driving Month in April, we have a lot of gravel on our roads for spring breakup, and that's just what Alaska drivers have to deal with. Gravel on roads present its own special safety challenge because vehicles don't have the traction on loose gravel that they would on pavement. So including when you add speed in, it's hard to stop quickly and you end up skidding. So with construction materials, weather, traffic volumes, and vehicle weights, it changes the gravel road conditions very quickly. So it's important to pay close attention on the road surfaces while driving. So some tips to decrease your risk when driving is to slow down, avoid sudden changes in direction, accelerate and brake slowly, and increase your following distance. On the bottom of the screen, there's a link to our street maintenance for the municipality to promote awareness on the status of snow removal, plowing, pothole repair requests, street sweeping, and maps, including and other resources. So keep that in mind while driving on these roads. Stay safe and enjoy the spring. End report.
Thanks, Annalisa. Public information.
Hey, good morning, everybody. Cale Casey here for the information officers. We were able to post about the new Northway location for vaccines on Saturday on Facebook, Twitter, and Instagram. And one of our PIOs went out there and got some good photographs that we'll be able to use this week to continue the promotion. The Mautosi Move and Love video, the link is right there for you, and it's all over the place. And that was a nice partnership between Andy Lyon at AHD and Laura Atwood at EOC. We're sharing graphics and messaging from the COVID-19 Community Corps regarding the vaccine now available nationwide to anyone 16 years of age and older. Coordinating with MAU on the permits needed for May 1 at Northway, and establishing outreach guidelines and coordination for all the tasks that are coming up for Vaccine Week. We're going to be working with Mass Care and Visit Healthcare regarding the Northway location to integrate the show on May 1st, the breakdance show, with the walk-in and drive-through clinic. We're coordinating with the liaison and Mass Care on strategy to maximize and highlight current or available local vaccination support in the Eagle River area and around our area for that May 1 to 8. Identifying community partners who can contribute time and prizes to get more effective participation and outreach from the business community. And our daily email is going out every morning with all sorts of great flyers and information in it and appointments. And then we did add all the ops videos and other videos to our YouTube channel. So we're using another of 3 or 4 different social media platforms out there to reach more folks. And a report for information officers.
Thank you, Kale. Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for Anchorage Emergency Operations Center. I'd like to thank all of our partners who were able to join us, and is Kirsten on for Alaska Native Medical Center.
Good morning. This is Kirsten Cole with ANMC. This morning we have 2 positives. Neither are in the CCU or on a ventilator, and 0 PUIs. End of report.
Great, thank you. And Sean, I believe you're on for Alaska Regional Hospital.
Good morning. Alaska Regional Hospital has 5 positive COVID patients, all of whom are in isolation, no vents, no ICU patients, and 2 PUI.
Great, thank you, Sean. And Michael, are you on for Providence Alaska Medical Center?
Yes, good morning. We have 13 positive, 6 who are in the ICU, 2 on mechanical ventilation, and 5 who have recovered but are still inpatients.
All right, thank you very much, Michael. And is Captain Arbach or anyone else on for the 673rd Medical Group?
Good morning, it's Sergeant Perez with the 673rd Medical Group. We're just reporting out on our vaccine numbers again. Jaber has received a total of 16,675 vaccines and has administered a total of 14,461. Pending any questions and a report.
Thank you very much, Sergeant Perez. We were curious how many people on the base, or how many soldiers, I should say, have had both their vaccines. And if you don't have that now, if you have a chance, I could get that back to me. That would be really appreciated.
Yes, ma'am.
Thank you. And so Matsu Regional Medical Center, Kara was not able to join us, but she is reporting out 10 positives, 4 in the ICU, 2 on ventilators. I'm sorry, excuse me, nobody on ventilators, and 0 persons under investigation. And that's all for liaison. Thank you.
Thanks, Celeste. Anchorage Health Department.
Good morning, everyone. Kelly Byastock with the Anchorage Health Department. So the overall risk level has dropped slightly and is now on the boundary between the considerable risk and high risk. So we want to continue to see the arrow moving to the left. Daily new cases decreased this week but remain high. As mentioned, the current 14-day rolling daily average of 22.27 cases per 100,000. That's about an 8% decrease over last week. That keeps us at the high end of the high risk category for the health risk metrics. The reproductive number of 0.99 is lower than last week's consensus estimate of 1.08. While vaccination coverage continues to increase, hundreds of appointments remain available daily. Approximately 50.1% of Anchorage residents aged 16 or older have received at least 1 vaccine dose, and 40.6% have completed the series. However, because children under age of 16 cannot yet be vaccinated, only 39.3% of the entire Anchorage population has received at least 1 dose, and 31.8% have completed the series. So the lack of demand for the 2-dose vaccines and the fact that we had to pause on the Johnson & Johnson vaccines is concerning. So COVID vaccines do protect you, your family, and your community. So please get them and keep your community and yourself and your family safe. Thank you.
Thank you, Kelly. And Bob.
Good, happy spring Monday. Finally, y'all. I think with the snow melting, it's clear spring is finally coming here. In many ways, it is with our response too. If you didn't catch up with the increasing themes on these discussions of vaccine, a priority for us is overcoming hesitancy and access. You see that at the Northway Mall and shifting in hours. We're trying to overcome access issues. If, as a reminder to all on this call, mobile vaccination team requests are still out there, are still available out there, and you can get those through our website to go online and do that. But the goal here is to get shots to everyone who gets shots in all arms, no arm left behind. And if there's an access issue, we need to overcome it. If you have an idea for another means of doing that, a venue or time, please let us know. And if there's a group who just can't get to any of those, we still have the mobile vaccine team request out there. End of report. Thank you.
And our next briefing will be April 22nd at 10 a.m. Thanks, everybody. Enjoy that wonderful sunshine out there.